So the process of diagnosing and then discussing and then managing wisdom teeth. Firstly, someone like me, you might present to me directly, that's fine too, or you may be referred to me by a dentist to discuss removal of your wisdom teeth. Usually they would have been detected either incidentally on an x-ray, or you may have presented with some symptoms, some localised pain that's prompted you to come for opinion. We'd look together at the mouth, so I'll be looking in the mouth to see sort of where the wisdom teeth are, whether they've partly come through, what sort of inflammation or potential plaque traps there are around the area, and then advise you on the need for removal of 4 or however many there are. Often a patient might have a partially erupted lower wisdom tooth and a fully erupted upper wisdom tooth, and so we discuss the need to keep any of the wisdom teeth. Most often the wisdom teeth function on each other, so if one's lost then the upper one becomes useless, and ultimately all it is a bit of a plaque trap without any function, so we often remove the 4 together, which is ultimately the same duration of recovery and just minimises the time off work and school. We discuss the x-ray together, and I look at all the potential risk factors. So everyone has varying degrees of risk depending on the degree of impaction, as well as the position of the root tips to the more important structures in the mouth, so the sinus floor in the upper wisdom teeth, and then the sensory or feeling nerve in the lower jaw that supplies the sensation to the lower half of your lip teeth, chin and gums in the lower jaw. Whether that nerve is close to the wisdom tooth or not will determine sometimes your suitability for whether you can have this procedure in the chair under a local anaesthetic versus in the hospital under a general anaesthetic, and may also decide or prompt whether you need some further investigation, such as a 3D scan to better look at the relationship of that tooth to the nerve. After we've discussed and looked at the surgical procedure itself, we discuss the recovery times. So usually I'll let you know that the procedure takes somewhere between 30 to 45 minutes, whether you're in the chair or asleep. The benefit of being asleep is that you drift off to sleep, we give you the local anaesthetic while you're asleep, and you wake up numb, so it's all done and you don't remember much of it. The only downside with hospital is potentially the costs of the hospital day surgery fee and the anaesthetist, which is extra. But if you've got private health insurance, that's often heavily rebated. And also a bit of the time wasting around having to be admitted to hospital and needing someone to drive you for 24 hours after surgery. Local anaesthetic, however, you can eat normally on the day, there's no fasting periods, you can drive into the procedure and drive home, but obviously you're going to be awake and aware of what's going on. So those patients that are relatively anxious, I always potentially advise them to consider being asleep, because it can be quite a stressful experience for some if they're not willing to or if they are unable to cope with that sort of anxiety. So we talk about the potential side effects from surgery. So there could be some localised swelling, which tends to peak 2 days later and settle within 4 or 5 days after surgery. Regular icing helps to minimise that. It also is dependent on the degree of impaction and how much bone removal is required at the time of surgery. Swelling is a bit of a hassle, but it's not usually painful. Ultimately, the degree of swelling depends on how big the incisions are made to remove the wisdom teeth. So I try to make smaller incisions to help minimise the amount of swelling that patients experience after surgery. Pain is variable. Some people require no pain relief at all. Most people require just simple Panadol and Nurofen, and some people require stronger pain relief maybe for the first few days. It's usually only for 3 to 4 days that pain relief is required. Some may require it for up to a week. Again, it depends on the degree of impaction and your pain threshold. All of those things are provided to you on the day of surgery. The other things, soft diet, of course, as is sensible. I will ask most patients to go on a soft diet until they feel ready to start eating normally again, so that's something left up to you. It's important to take maybe a bit of time to rest, so 2 to 3 days at least, avoiding excessive or heavy exercise or high impact or heavy contact sports for at least a few days until recovery is complete. And also, preparing for time off work and studies. Usually I give a 1 week certificate, but most people only require 3 to 4 days of that. You'll get some dissolving stitches sometimes in the sites where we've had to sort of open a little bit of tissue to expose the tooth. They fall out usually a few days up to a few weeks down the track. On the day of surgery, I go through thoroughly how to keep and look after the area after surgery and what to do to minimise the number of complications from recovery. And most people find it's actually a lot easier than they expect when I see them in their 2-week review. One important aspect of recovery is to ensure that you do 3 things. Firstly, to keep the mouth clean. So we discuss brushing teeth forward of where you've had the surgery, gently using warm tap water until the feeling is back to normal, which can take up to sort of 9 hours, up to even a day to return. Using a mouth rinse after and before surgery, and also after surgery. Simple Savicol mouthwash is really important for the first week, I feel, and that helps to keep the area clean, given you can't brush it. A week later, I stop the mouthwash and ask patients to just rinse with warm water. It can be salt water if you prefer, and then use a special curved tip syringe called a Monojet syringe that helps to actually flush out food that might trap into the socket holes, particularly the lower ones. Usually I run through that technique at the 2-week review appointment as well, and that may be required up to about a month after surgery. By keeping the area clean, you reduce the risk of inflammation and infection, and also bad taste from old food that hangs around the site. Pain relief is really important, and I like patients to take preventive pain relief. So sometimes if they're having local anaesthetic, I'll ask you to take a couple of Panadol Nurofen tablets. The Maxigesic is a good one. 2 tablets of that about half an hour before surgery to sort of block those pain receptors before you've even had procedure. And they're really important to take with food to help protect your gut lining. And then I like patients to take it every 6 to 8 hours for the first day, whether or not there is pain, because often it's masked by the local anaesthetic. At least then if you've got good steady pain control as a baseline and the local starts to wear off, you can sort of sense how much more pain relief you require. And obviously if there's still pain, despite the simple pain relief, I'll give a script for something a little stronger, which can make you drowsy, so often is nice to use before bed to help you to sleep, but also important to ensure you don't drive after that. And then lastly is regular icing. The more you ice, the less you swell. So I like patients to use ice packs on the outsides of their cheeks, if it's both sides, on the outsides here, often held on with a bandage or a little sort of stockingette. And that's usually for 4 days. I like patients to lie a little bit head up for the next 4 days to allow any swelling to drain down. Bruising might appear, and that can track down your neck, and that's more due to gravity. But the more you ice, I find the less patients swell. Now, after discussion of all that, I'll give you a quote for your procedure, and the cost will depend on the degree of impaction. There'll often be some item numbers associated with each extraction, of which you can go and then discuss with your private health fund if you've got dental cover. Usually it needs to be major dental cover or cover for wisdom teeth, as to how much you're going to get back and how much you have to pay out of pocket. The quote then will discuss the cost for the hospital fees, which is usually a day surgery excess, and also the anaesthetist fees. And with the anaesthetist, you get both Medicare and private health rebates, so it actually comes to about 50%, down to about 50% of the cost. Then we give you possible upcoming surgery dates and locations where I work. I work in about 2 to 3 different day surgery hospitals throughout Melbourne, which allow you to have your general anaesthetic done, as well as some local clinics, which are not hospitals per se, but may be cheaper if you're uninsured. Leading up to the surgery day, once you've confirmed a surgical date, you'll get confirmation emails and text messages to confirm your procedure, usually about 1 to 2 weeks prior. We'll send further information, including anaesthetist details, as well as online links to do your online paperwork for admission processes. And about the day prior to surgery, your appointment is confirmed. We talk to you about when to come in, what time to arrive, when to start fasting if you're going to be asleep, and also what time to arrive, particularly at the hospital. Your review appointment will usually be about 2 to 3 weeks after your surgery. It's complimentary, and I will see patients for about 15 minutes and run through their recovery, and also reinforce and just instruct or give a demonstration on the syringing process of keeping the mouth clean. You'll always have contact with me. You'll always have my mobile number for contact if you have any concerns during the recovery period. At Tenler Dental, I offer wisdom teeth extractions under a local anaesthetic, and I can arrange for patients to go to hospital to have them under a general anaesthetic if it's deemed necessary or if the patient prefers that.